Hello and welcome to another segment of Mindful Health Alternatives. I'm Darlene Young from Arlington, and I'm here to welcome you, and I'm welcoming Josh Samuelson, who's the director of Northshire Medical Center campus in Manchester, who practices some integrative therapy, and he's going to talk to us about integrative therapies today. Welcome, Josh.
Thank you. Thanks for having me.
You're very welcome. I'm so glad you could come. We sort of tried to do this last winter and we just couldn't get our schedules to work. So now we're doing it and it's going to be a really good show. I'm looking forward to it. So Josh, tell me a little bit about your position at Northshire.
So I'm a full-time family physician, and I'm the medical director, which means that I get to do extra administrative stuff on top of it, and ensuring clinical quality, which isn't a really hard thing because we've got a great group up there. So in my practice, I practice family practice, not quite the full scope. We don't do OB up there, but I also bring in integrative medicine, an extra interest of mine, and that's a pretty broad category of things. But it's a way of being able to offer extra things to patients, which is often in their own interest, and being able to bring in the evidence part of it to help them know how to best manage whatever way they're interested in taking care of their medical problem.
Great. Now, you're a doctor of osteopathy. Right. Can you tell our viewers the difference between a DO and an MD, please?
So an MD is your traditional allopathic medicine, and so that is what most people are really used to. And osteopathy was formed about over 150 years ago, when allopathic medicine was not offering a whole lot to us other than poisons. So it was a system of hands-on and manipulative therapies that were really designed to bring about a healthier system as a whole so that the body could do its job of healing itself. Over time, as allopathic medicine has come along and given us much better medicine, the two systems have come much closer together. But the osteopathic tradition still teaches the hands-on manipulative therapies. So that's one of the things I also do as well.
Good. Very good. So let's get started. And as I told you in the beginning, the topic today is integrative therapy or integrative medicine. So would you like to start and tell us a little bit about integrative medicine and what it involves and how people can get involved with it?
So it's a pretty broad topic. It involves everything from acupuncture to aromatherapy to meditation, those things that augment what Western medicine or allopathic medicine has brought along, and bringing in the evidence-based side of things. For instance, for chronic non-specific low back pain, the orthopedist may not be the best person to see, but the acupuncturist might be a good person, the chiropractor, the osteopath for manipulation, as well as physical therapy, as well as reducing stress with meditation, because there's a big link between stress and that low back pain.
Is there? Okay.
So all those things should be addressed, and knowing which way the patient really seems to want to go is helpful, because just like with Western medicine as well, that which you believe will work will most likely work.
So basically you're treating the whole patient with the integrative, like mind, body, and sensorium and all that sort of stuff, where Western medicine basically focuses on the disease. Is that true?
Well, it's becoming less that way.
Okay.
So it's always seemed very disease focused, and as time's gone on, Western medicine has brought in the ideas that stress can cause problems. For instance, stomach ulcers and things like that. It's known that that definitely contributes. So it has been a long time coming that idea of the disease has to be eradicated, and that's the entire focus. Whereas if you look at the person themselves and augment all the other healthy parts of them, their body can often do a good job of helping to fight whatever the problem is as well.
That's good. It's very good. What else do you think, like you could treat? I mean, we've talked about low back pain. Can you treat, like allergies and different things like that with integrative?
Sure. Well, if you look at allergy shots that people get, they've been getting for a long time, that's actually a homeopathic concept of kind of like cures like. So presenting kind of ever increasing amounts of the offending agent, greatly diluted at first and less so as time goes on to really desensitize the body. So that's one way of actually looking at it as it is. And there are other ways. Acupuncture does have some help in that regard. And then taking a really strong look at the diet and other environmental factors is a really big part of it. So there are certainly ways of handling it in an integrative way other than just taking an antihistamine every day.
Sure. I had a friend who has severe osteoarthritis and recently saw her rheumatologist, and the medication that the rheumatologist had the person on isn't really working that great. So the rheumatologist offered another medication to be taken at night, and then even suggested that if things continued and the daytime medication wasn't doing its thing, that perhaps medical marijuana would be somewhere that the patient would be going. So with osteoarthritis, as opposed to rheumatoid, there's not a lot of things one can do except like lose weight. And they say that exercise is better for osteo, but sometimes the joints just don't want to do that, As an integrative physician, have you worked with people with arthritis and, different suggestions to them? I mean, there's always pool therapy, which is better probably than, going to the gym,
Absolutely. So warm water pool therapy in particular is really helpful. And so being in the pool is obviously as close to zero gravity as we can get. And so that really helps to be strengthening those muscles that cross the joint, which will then help stabilize it, but not doing it in a manner that actually hurts the joint more. So swimming's a great exercise. Acupuncture has great evidence for helping out with osteoarthritis. And then oftentimes people find that certain things in their diet really affect their pain levels from one day to the next. And then you can add in certain things, certain herbs that can be more anti-inflammatory and things like that. So curcumin as part of curry is a great kind of extra remedy to help out with pain, and over time it can really act as a potent anti-inflammatory. So, and this is systemically beneficial, and you don't really have to worry about it harming your kidneys.
Well, that's good. So I'm going to sort of turn the show over to you. I've asked you a few questions and let you take it away and, give us your take on integrative medicine and how over the years, how did you get interested in it? And how the changes that you've seen and where you think it's going. I know earlier we had talked about the insurance coverage, and yes, insurance pays for like most of your medical things, but when it comes to integrative therapies, it doesn't always pay, and most of the time doesn't pay. So, if you want to talk a little bit about that and your experiences, that would be great.
I have to credit a lot of it to my mother, who was always looking for home remedies and things like that growing up. And so she spent a lot of time listening to radio shows, reading up on different things, and found that some of it was just gimmicks, some of it was actually helpful. So that was a big introduction for me into just the things other than what the doctor told me about that may or may not help. And so it also made me more interested in the evidence-based side of it, because I don't want to see people using things inappropriately, wasting their money, harming themselves, and using things inappropriately. And as time's gone on, more information's available. People are able to look things up on the internet and ask Dr. Google all the time, which often can be helpful and many times can be misleading.
Sure.
And so being able to come alongside the patient and really say, yes, valerian root might be a great thing for your anxiety, but you can't take it for more than 4 weeks or else it'll be harmful. And so people knowing that ahead of time can be really beneficial. And through school, through med school itself, I found that I really liked the hands-on aspect. And one of the big things about integrative medicine and the Academy of Integrative Health and Medicine really emphasizes the point that connection with the patients is at least a big healer's anything that you will prescribe.
Right.
So that hands-on connection, I think, is really helpful for me because I enjoy it, and it really helps the patients to be able to feel better.
Yeah, and I mean, you've got to be able to have a rapport with your patients, because I think if you can get a rapport, patients feel more comfortable, and I think it helps with the healing, you know?
It does. And, you know, patients have that intuitive sense of what they think often is going to help them. Often they're right. Sometimes they're misled, but often they're right. And if you can help them to know which path to go down and which, you know, what the end point should be, and if that doesn't work out, what's going to happen next. And, you know, if the non-Western treatment is not going to work, then here's the Western treatment, and we can try that too. We've got a backup. So it's more tools in the bag. And that's what I liked about it is sometimes you just feel like you're hitting a dead end with something, and this gives me another way of going around it. As far as the insurance payment question, that's a tough one because some insurances seem a little more open to it.
Oh, okay.
And some don't. When I first moved here, I was used to all the insurances where I came from covering osteopathic manipulation. And I was performing those and found out that there was a certain insurance that wasn't covering it.
Wow. Okay.
So it would cover chiropractic, but wouldn't cover osteopathic. So I ended up having to refer those patients elsewhere. Since then, the rules have changed, and now it's
Really? Oh,
it's
good.
covered. So, you know, there are listening ears out there that want to know. And within the Affordable Care Act, there is embedded specific wording to integrative therapies. And they talk about any licensed healthcare provider should be a covered
Really?
A covered expense. So that said, Medicare is exempted from that. So the government exempted itself. But other insurances are required. Now the ins and outs of that are tough because not a lot of people know about it. I've had people kind of try to challenge their insurance on it, and it's kind of been a mediocre results from it. But it is within the law.
Good.
So more of it should be occurring.
Good. So we're making strides in that regard. So that's very good. There's a gentleman, and we had talked a little bit about this ahead of time too. Is it Dr. Weil? Andrew, is
Andrew
it Weil? Or okay.
Yep.
You want to tell the viewers a little bit about him and your experiences of, you know, his thoughts?
So Dr. Weil has been around for a long time. He's written a number of books, and I would say he's credited in large part with the amount that the population in general knows about integrative therapies. And he has a website, and he does review a lot of different therapies as well as disease states and how to treat those. And he covers the the evidence-based part of those things, and what is potentially helpful, potentially harmful, absolutely harmful, or absolutely helpful. So, and he brings in the mind-body aspect a lot with it too. The benefits of meditation, the benefits of exercise and various kinds of exercise, and the benefits of spirituality and following a spiritual practice, because we know that that does help people, makes people happier in general, less depression, less anxiety, and those with less depression, less anxiety tend to have that better overall health profile. So he has kind of brought things along, and he had a fellowship in Arizona where he was training people, and now there's an officially designated group overseen by the ACGME that oversees all the medical specialties, the American Board of Integrative Medicine, and one of his partners out there at the University of Arizona, Dr. Lodog, has actually been the one that's heading that up. So it's a great time for integrative medicine to be kind of coming into its own, officially recognized, and rightly so, because of all the different things that we know can really help people, and it will be of lower expense, which is a big part of the Affordable Care Act, or Obamacare, and really puts people in charge of their health, which is where they need to be in order to do well.
That's good. That's very good. I think I first heard of him a couple of years ago when my older brother had one of his books, and he was like, "Have you ever heard of this doctor?" And it's like, "No," but you know, and he really enjoys reading his information that he puts out in his books. Now, when you see a patient in the office, and I have run into this with some of my friends, when you mention integrative therapy or energy or any type of different modalities other than traditional Western medicine, people seem to think that it's a bunch of hooey. Because I've had a couple of other folks come in and do like zero balancing and cranial sacral, and a couple of other modalities that they've shown, and I've gotten some of our staff involved with it. And I would say out of the 6 of us that work here, probably about 4, think that it can help, but there's 2 that are like, whoa, this is just too far out. It's not going to do anything. So how do you reach a patient and get them to come over to integrative, or do they all come to you and say, I know that you can do acupuncture, I know you can do this or that? Or, then you've got the typical patient that comes in and says, my back is killing me. Can you inject it? Can you do this? Can you do that? How do you win them over to the integrative side?
Well, a lot of it is what they're interested in the first place. So if I try to force a medicine on someone who wants to take herbs, it's not going to go well. It's the other side of the coin. If I try to force acupuncture on someone who really can't stand needles, that's probably not going to go well.
Right.
So what you have to do is present it like you do everything else. Here's what I see as the problem. Here are different modalities that may help. What would you prefer to start with? Here's my recommendation. If that doesn't work, here's our next option. And so when people see that, okay, well, that didn't work, well, maybe acupuncture will. And I keep on saying acupuncture just because it's a well-known therapy, and people often are surprised by the results that they get from it. That's kind of how it's done. You can't force anything down anybody's throat and really have them respond well to it, because, again, if they don't believe it's going to work well, it's unlikely that it's going to.
Right, because there again, you're treating the mind and the body, and if the mind doesn't want to go there, it's not going to happen.
Right.
Okay. Good. There was a study that around 1993 at Duke Center for Integrative Medicine, and apparently they said how, what was it, 1 in 3 Americans had used alternative medicine, and they preferred it, along with their regular Western treatment. What do you see now? Is it more accepted by patients? Do you see more than 1 in 3, or, people using it? Or, I mean, just in your practice?
Yes, I find that people are a lot more open to it.
Okay.
For one, I think a lot of people have felt like the mainstream of medicine has kept these things from them for a long time, and that's due to various reasons, some of which is people outside the mainstream medical community making it seem that way. On the other hand, there's not a lot of education about it during med school, so a lot of physicians and allied health professionals are basically saying, well, sure, that might work, but I'm not trained in that, so I can't really tell you yes or no. But a lot of people do try things that are over the counter or, integrative. And so people will try fish oils or glucosamine chondroitin for their joint pains. And so a lot of people have tried those things because they're able to do it without going to see their doctor first. And I think more and more people are open to other things too. I mean, considered within the alternative approaches are things called yoga, which is definitely gained in its popularity over time. And that's really helpful for a lot of people with chronic pain, syndromes of various sorts, as well as balance issues and things like that. So I think that those numbers are probably on the rise. The 1 in 3 is probably a low estimate at this point.
Now, a question, and maybe we don't want to really discuss it a lot, but maybe we do. Medical marijuana, is that helpful in integrative, or like with glaucoma and with arthritis and stuff like that?
Sure. Well, there are certain medical problems where we know that medicinal marijuana has shown some benefit. And so there are other treatments as well that are often useful in those situations. So I don't see it really as an integrative issue. I see it more of one of the things that can be used even within mainstream medicine. It's highly regulated and for good reason because it is abused.
Right.
But it is something that is at some points the only thing that's going to work for certain people because they have truly tried everything else. So in my view, yes, it can be useful in certain situations, but it should be with oversight and attention to how it's being used and what other things are being done at the same time to really improve function, because that's the goal of using medicinal marijuana. It's one of those things that you've really tried a lot of other things. We're really trying to improve function. And if all the person is doing is using it and laying around the house all day, then we're not getting where we want to be.
Yeah.
So those are things that really need to be kept in mind.
Now, back a ways, you said that, if you can't help, or if the insurance won't cover osteopathic manipulation, you would send somebody to a chiropractor. So you don't have someone come to the office and set up working out of your office. They have their own offices and you send the patients.
There are other well-established practices around here. And the small communities that we have around here, people know the other providers. So I think it's important that we participate in that connection with the other providers that are around that have established their own practices, their own trust with the community. And it's been really beneficial to our practice and to the patients.
Well, it also forms good relationships with the other providers in the area, so that's good.
It does, and we've got a lot of really good and trustworthy providers that we feel that we can refer to in good faith, that they're going to really take care of our patients.
That's very good. Now, here in Bennington, we have an integrative therapy group that comes out of New York. They have their own offices and things, and every once in a while they offer workshops, more in the New York area, but every once in a while they'll have, like a workshop or something in an evening here at their office. Have you ever done anything like that in Northshire?
We haven't done that yet. No, it's something that I would like to do eventually. The interest is there in integrative medicine. It is something I'd like to address, maybe a specific couple of common medical problems and how to manage those in an integrative way, safely and helpfully. So it is something we've talked about, and it's something I'd really like to do.
Oh, good.
At some point.
Look forward to that. That would be really good.
I'll let you know.
Okay, great. So is there other things that you want to bring up about integrative and tell the folks a little bit more about it?
Even if you think that your healthcare provider doesn't know a lot about integrative medicine, I'd still encourage you to approach them and ask them about it, because there are ways of them looking up and seeing what the real evidence is for certain things. And you want to do it the right way, because you can harm yourself. I like to remind people that hemlock is an herb too. And herbal therapies are not all benign. So we have to keep in mind what is really the best. And if your provider is not the most knowledgeable and is admitting that and doesn't feel comfortable with it, then they should be able to point you to someone else who can.
And there again, if they know you're more comfortable with integrative, they can send them your way.
And another important part of that is your provider needs to know what you're taking. So if you are taking some herbs or other kinds of treatments, they need to know, because it could interfere with any medicines that you are on. It could have a cumulative effect on kidneys or liver. And that's important for your provider to know. Or certain things can have blood thinning properties, so you need to stop that in advance of surgery.
Right.
And so be sure to share all of it with your provider. They're probably not going to yell at you. They're probably really going to try to help you out with it.
Yeah. Oh, that's great. Well, I'm really so glad that you were here, and I think we've covered quite a bit of material. Closing thoughts?
No, thanks for having me. I've enjoyed it.
Thank you, and I hope you'll come back again and come and visit us and do another show. It's really been great.
I look forward to it.
Thank you.
Thanks a lot.
Thank you very much.
Thank you.
You're welcome. Well, thank you everybody for tuning in, and we'll see you again with another segment of Mindful Health Alternatives. Thanks to Dr. Josh Samuelson from Northshire Medical, and we'll see you again. Bye.